Hello, and welcome to the Asthma and Allergy Foundation of America's latest education program titled Understanding Nasal Polyps Part 2, Medical Treatment Options. Today's program is developed independently by AAFA and made possible by support from Sanofi, Regeneron, Amgen, and AstraZeneca. This video is the second in a series called Patient-Centered Education and Care for Nasal Polyps, or PEACE-NP. The overall goal of PEACE-NP is to support people with nasal polyps and improve the patient-clinical partnership in managing and treating nasal polyps. My name is Jay Norris, and I'm the Mission Program Administrator here at the Asthma and Allergy Foundation of America, and I'll be your host for today. I'm also happy to introduce you to our speakers for today, Doctors Tanya Laidlaw and Kathleen Buchheit. Dr. Tanya Laidlaw is an Associate Professor of Medicine, and Dr. Kathleen Buchheit is an Assistant Professor of Medicine, both at Harvard Medical School in the Division of Allergy and Clinical Immunology at Brigham and Women's Hospital. Thank you both for being with us today. Please take a moment to review our disclosures. In today's series, we'll discuss nasal rinses or saline rinses, intranasal corticosteroids, oral steroids, other treatments, and when to consider surgery or advanced treatments. Additionally, if you would like a review of our previous workshop, which was entitled Nasal Polyps Basics, please review that at aafa.org/NPS. Dr. Laidlaw, I'm happy to pass over to you now for our presentation.
Thank you so much. So I'll go through a few slides talking a little bit about nasal rinses or saline rinses. And frankly, these hardly even count as a true medication since it's truly just salt water. So these are often referred to as a saline rinse, a saline irrigation, a nasal rinse, a nasal washing, and truly it's a way to clear your nose and help your sinuses clear out from mucus. So it can remove that thick, almost like concrete-like mucus that can get stuck up in the sinuses. It can remove allergens that you might have inhaled or bacteria throughout the day. And it can also reduce some of the inflammation and swelling in your nose. It also can help to make your steroid medications that we'll talk about next, like nasal sprays, work a little better because it will clear out some of that thick mucus that gets in the way of then the intranasal steroid working. So in the next section, when we talk about intranasal steroids, if you're doing both a nasal rinse and also a nasal steroid or nasal spray, make sure you do the rinse that I'm talking about now first, and then afterwards do the steroids so that you're not rinsing out the steroid. These are things that are safe and can be done multiple times a day. So often patients actually want to do them once or twice a day because it feels as though it helps to get rid of a lot of that congestion and that mucus. And for patients who are doing really well, often just once a day is fine. But for patients who are feeling they might have a flare or a cold come on, or have been in a particular area with a lot of pollen or a lot of particulate matter, doing it twice a day is also typical for many of our patients. So what do you need to do this? Right? You really need three things. One is clean water. So you need to use either sterile water or water that's previously been boiled and cooled to make sure that it's totally sterile. So we're not putting anything dirty up into our sinuses. We don't want you using tap water or anything that might have any contaminants in it. And this is something that's going into your nose. And so it's often more comfortable to use slightly warmer water. Cold is fine, it just can feel a little weird. But make sure you don't use really hot water because the inside of your nose is much more sensitive to temperature than maybe your hands would be. Then you want to add a saline solution into it. And that's because it makes it much more comfortable and much more tolerable if you add the saline solution. And there's two ways to do this. One is you can buy little pre-mixed packets that usually come with one little packet per cup or per 8 ounces of water that you mix. Or there's a recipe below where you can actually make your own using just salt and baking soda. You combine those together with the recipe below, add it into your cup of water, and use that for your solution. And then thirdly, you're going to need some device for how to get it up there appropriately. We find that most of our patients prefer using a squeeze bottle, and I'll show you how to do that in a second. There's ways you can purchase bulb syringes or a more traditional neti pot that we'll talk about. And there even are battery-powered nasal irrigation devices that some patients prefer, but honestly, starting off with a regular squeeze bottle usually works just fine. So in terms of how you use it, patients will find they have very strong preferences one way or the other. I'll often tell patients if it's their very first time ever using it, you might want to try it in the shower because you make a little bit of a mess, and that way it can just go down the drain. You don't have to worry about it. But if you prefer, you can certainly do it over a sink as well. But keep in mind that all of the saline rinse that's going in is going to come out. So you need to have something underneath it that's going to catch it. So a simple towel probably won't be enough. And the technique that we provide is you actually want to have the patient lean forward a little bit and then use whatever the device they're using. On the top is a more traditional looking neti pot. On the bottom is a squeeze bottle. And you want to cover the one nostril that you're doing first with either the tip of the neti pot or the tip of the squeeze bottle. Have your mouth slightly open. You can breathe normally through this, and you want to slowly squirt. Some patients do have some discomfort if they go too quickly with too much pressure. So you want to do it slowly, a few squeezes at a time. And often, if you get good drainage, you can actually have the fluid come out the other side, which feels a little weird at first, but it suggests that you're actually getting it in the right way. And remember, this is just clean salt water, clean saline water. So it's okay if some of it goes down the back of your throat. In general, patients find these actually to be quite comfortable once you get a good technique for them that works really well. And whatever of the techniques in the sink, in the shower, with a neti pot, with a squeeze bottle, whatever works best for you is the technique that's the right way to do it. We don't have a preference from the sort of medical standpoint of which device you should use. And this way, everything that kind of washes through there helps to make sure that all that thick mucus gets loosened and can come out. I'll pass it off now to Dr. Buchheit to talk about intranasal corticosteroids.
Okay, thank you so much. Intranasal corticosteroids are really part of the first line treatment for nasal polyps, meaning that it's one of the first things that your doctor or provider will generally prescribe for you. And what these are steroid medications that are applied topically. So you spray them directly into your nose. And what that means is that they can provide some anti-inflammatory activity directly to the area that gets inflamed. So usually it's a sort of primary choice for therapy in combination with the nasal rinses that Dr. Laidlaw talked about. And they can reduce the swelling in your nose and actually shrink up the nasal polyps over time. These are not fast-acting medicines. They work best when they're used continuously, so used daily, and also with the proper technique, which we'll talk about in a minute more specifically because it's really important. But you shouldn't expect that your symptoms are going to get better immediately when you use them. You want to give these, at least a month, if not longer than that, to really work. And by continuous use, they will continue to reduce inflammation little by little bit over time so that your symptoms improve. And what's nice about the way these are formulated is that they're designed to have minimal systemic absorption. So not a ton gets into your systemic circulation and impacts other places in your body that don't have inflammation. They really act at the site where the inflammation is. These are actually, for the most part, available over the counter. And some common examples are fluticasone nasal spray, budesonide nasal spray, mometasone nasal spray, or triamcinolone nasal spray. The technique for which you use it is really important in terms of how well the medicine is going to work and also preventing side effects. So in general, if you forget everything else, you want to remember that you want to kind of angle the spray laterally a little bit toward the outside part of your face. So, one technique is to use the opposite hand, so right hand for left nostril, and aim toward the outside wall of the nose. You don't want the medicine to all land on the septum, which is the bone that goes between the nostrils. And the reason for that is that the tissue that overlies the septum is pretty delicate and it can get irritated. You can get nosebleeds. And then the side effect that everybody worries about that we really want to prevent is a hole developing in the septum. That's super rare, especially with proper technique, but something just to kind of remind yourself about why it's important to use the nasal spray properly. And then you can breathe in gently when you do the spray and kind of help the medicine land where it needs to in your nasal cavity to really get at some of the inflammation. If you do start getting nosebleeds, it's important to take a few days off from the nasal steroid spray. You can continue the nasal rinses during this break. And then, as the bleeding is kind of getting better, you can restart it. When you resume, you want to use the proper technique. You could consider also adding a humidifier to your bedroom if needed. If the bleeding's really bad or not stopping, you should, certainly think about seeking medical attention and potentially seeing your ENT doctor during that time frame. So another approach that we frequently use after we've tried nasal sprays, usually try nasal sprays first, and if it's not enough, we will try these high volume steroid irrigations. These are also frequently used for patients who've had surgery in the kind of post-operative setting after sinuses have been opened up. And this is really a way to deliver large volume, low pressure steroids to coat deeper into the sinuses, which is why it works so well after someone's had surgery. This is done with prescription steroids which can either come from the pharmacy. Sometimes we'll use budesonide respules, or sometimes come from a special compounding pharmacy. And sometimes compounded budesonide or memetazone is available that way. And you actually put it into one of the nasal rinse devices that Dr. Laidlaw talked about, and can irrigate your nose and sinuses the same exact way you normally would, but with the medicine in the irrigation bottle. So it's kind of one-stop shopping for that. A potential alternative method, which you should do really at the discretion of your provider who's caring for you, is actually directly instilling the budesonide respules into your nose. And there is some data suggesting that this head down position here, where you actually are basically leaning off a bed with your head kind of in this downward position on a pillow, or leaning on the floor with your head in a downward position, and instilling the budesonide directly, the drops directly into your nose, that can help to get the medicine into your sinuses where it needs to go. So that's certainly something that helps some patients and is worthwhile to discuss with your physician. And then the newest available delivery method is something called the fluticasone exhalation delivery system, which is actually a positive pressure system where you will take a deep breath and then exhale into the device, and that helps push the medicine further into the sinus passages. And it can be helpful for patients who've not done as well with the intranasal steroid sprays, or who don't tolerate the irrigations with budesonide in them. So it's kind of a nice alternative option, something to bring up to your physician if you've tried the sprays or irrigations and not had a good outcome. And I'll hand it back over to Dr. Laidlaw.
Thanks so much. So we'll just spend a short moment now on oral corticosteroids, often shortened to OCS. So probably the most common form that you might get in the United States for this is prednisone, which comes as a pill form, and there's also liquid formulations as well. So these are systemic medicines, and in fact, they're very similar to the intranasal corticosteroids that Dr. Buchheit just talked about, except they're formulated differently into a pill you take by mouth. It's much higher doses, and we really try to reserve these for use for very short bursts when you're really not feeling well, you're flared, or we need to really rapidly reduce the polyp size. We don't want to have patients on them for long-term use, and we really don't want to use them more than at most like once or twice a year if we absolutely need to. So essentially the rule is we use them as often as we need to, but we hope we don't need to. We often will use them for patients who have nasal polyps and asthma if their asthma is flaring as well, because that can help to calm down asthma. So the problem with oral corticosteroids in many ways actually is that they work really well and they work quickly. And so, you're only going to get relief for as long as you're on the prednisone, the oral corticosteroid, but usually within a day or two of starting it, you really do start to feel a lot of symptomatic relief, both if your asthma and your polyps are flaring. And that relief will usually only last for as long as you're on the steroid. And you sort of bounce back to where you were before once the steroid stops. But the main problem is not that they work, it's that they have side effects. And I often will tease my patients that if oral corticosteroids like high-dose prednisone had no side effects, I would happily prescribe them all day long for my patients and I would retire early. But unfortunately, and we'll go through on the next slide, how many side effects they have. So the list of side effects is pretty long. And this is what we worry about. So in terms of short-term side effects that we see quite often, these are the things that patients are going to notice on the next slide that has a list of those for you. And the things that you'll often notice, patients will often get problems with sleep, short-term weight gain. It can increase appetite quite a bit. It can affect blood pressure. And you can start to really get some sort of psychological side effects, a lot of what's called emotional lability. Patients will sort of cry and laugh in the same day. But you also can have short-term risks of things that you don't necessarily see: blood pressure issues, glucose issues, and glaucoma. The long-term risks, and this is both for being on them long-term continuously or even patients who needed short bursts but really frequency, have an increased risk of a lot of things: cataracts, infections, osteoporosis, right, sort of thinning of the bones. For patients who are more prone to diabetes, it can really affect your blood sugar and glucose levels, your skin with bruising, and can cause long-term issues with depression, and separately long-term issues with obesity, weight gain, and trouble staying at a healthy weight. So truthfully, although yes, when we need them, we will use them, because the risk of side effects is so long, we try to avoid this as much as possible. And much of the research and the work that's gone into trying to improve medications and provide new options for therapies for patients with nasal polyps is to avoid having to use long-term or high-dose corticosteroids. So I'll now turn it back to Dr. Buchheit to talk about other medical options.
Great, thank you. So, in this section, we're going to go through kind of a whirlwind of a few other treatment options that may help. And these treatments are actually also used for asthma, allergies, infections, but sometimes they're also useful for helping with some of the nasal polyp symptoms. So we'll talk about leukotriene modifiers, oral antihistamines, we'll talk about allergen immunotherapy, some of the nasal decongestant sprays, and also antibiotics. So again, these may not shrink the polyps, but can help control some of the related conditions or ease some symptoms short term. So leukotriene modifiers are medicines that are approved for asthma, a couple different asthma indications, and also for allergic rhinitis. These are pills that can actually help to, reduce some swelling and inflammation in your nose and also your lower airways in your lungs. And, we often use them for patients with nasal polyps, especially folks who have asthma. And we use them a lot for patients who have subtype of nasal polyps called aspirin exacerbated respiratory disease. A couple that we'll specifically call out are montelukast, which is a pill that can be taken once a day. And it might help with asthma symptoms. It can help with some exercise-induced asthma symptoms. It can help with allergies, and it can also help with some nasal polyp symptoms. Sometimes some of the mucus production can be reduced with it. There's an important, but really rare but important side effect, which is that it is associated with neuropsychiatric symptoms. So changes in mood, behavior, or sleep. And what's most notable and I think important about this is there are patients who've developed suicidal ideation when they go on this. So this is just an important thing to kind of watch and see if you're having any new symptoms or changes in symptoms, and let your healthcare providers know if you are. Xyluten is another option, which is approved for asthma, and it can help some nasal polyp symptoms as well. It's really used less commonly. The pills are quite a bit larger and you have to take it twice a day. It requires that you have some blood tests to monitor liver function while you're on it. And it often needs a prior authorization, but we do use it when there are diseases that have what we suspect, your physician will suspect having strong leukotriene involvement. And it can be really helpful in people with aspirin exacerbated respiratory disease. So, if that fits you, it's something you can ask your physician about. Oral antihistamines aren't necessarily a primary treatment for nasal polyps, but if you have nasal polyps and allergic rhinitis, it can be helpful for symptoms. I tell my patients this is helpful for like the itchy, drippy symptoms, not necessarily like the nasal congestion, not necessarily sense of smell, but it can help relieve sneezing, itching in the nose and eyes, and postnasal drip. We really, really strongly suggest using one of the non-drowsy formulations. One of the long-acting sort of non-drowsy ones would be something like loratadine, cetirizine, fexofenadine. And generally, we recommend that all patients avoid diphenhydramine as much as possible. So this is the brand name Benadryl, because it can be quite sedating. It only works for sort of more short-term use, or it's a shorter duration of action, so it doesn't last as long, and can be unsafe to use while you're doing things like driving or operating heavy machinery or doing something that really requires focus and concentration. Allergen immunotherapy, this is a treatment for people who have nasal polyps and also environmental allergies. So we use this a lot for patients with allergic rhinitis, but it can help patients with nasal polyps if they also have allergic rhinitis and they're getting bad kind of environmental symptoms. So they notice that their symptoms get a lot worse, with animal dander exposure, or for example, during the spring and fall pollen seasons, or with certain dust exposure. There are two types we use. One is injections, which are allergy shots or subcutaneous allergy immunotherapy. And also there are medications which can be given sublingually for sublingual immunotherapy. And this is important. We don't necessarily know that environmental allergies are causing nasal polyps, but in someone who has both allergies and nasal polyps, it can make the symptoms a lot worse. And, you can at least control one arm of the inflammation. The immunotherapy can help control the allergy-driven inflammation and can reduce the overall symptom burden to a certain extent. So, you might consider this with your doctor if your allergy symptoms are really significant and you can attribute them to specific exposures or they're poorly controlled. Nasal decongestant sprays are something that can be considered for very, very short-term use, but shouldn't be used on a long-term consistent basis. They work really well when you first try them. They can provide temporary relief from some of the severe congestion, but we recommend that people only use them for really a couple days maximum, really 1 to 2 days maximum. They can be very helpful for airplane travel if changes in pressure cause a lot of pain and discomfort in your sinuses and ears. And what I recommend to my patients is, you do, 1 to 2 sprays in each nostril before takeoff. And for a short flight, that's probably all you need. If it's a really long flight, you want to do a couple additional sprays before the airplane lands. But they should not be used as a daily treatment or really long-term therapy, because they tend to not work as well over time. And then you can actually become reliant on it, where you feel really terrible if you don't use them, and it can be really hard to stop them. So it's just better not to start from the beginning. It can, really be hard to wean off of them once you've been on them for a long time. And then antibiotics are not a treatment for nasal polyps. There have been studies of antibiotics for chronic rhinosinusitis in general, but they show that they're really less efficacious. They won't work as well for patients who have nasal polyps, and they're not usually helpful for chronic symptoms. That said, there are some patients with nasal polyps who do get bad sinus infections, and there are some people who get sort of chronic sinus infections or sinus infections that really are very difficult to treat. So in this case, it's really helpful to work with your doctor, the primary person treating the nasal polyps, to identify the best specific antibiotic for you. People who have frequent sinus infections really do benefit from having a sinus culture, so having the otolaryngologist take a swab of your sinuses to identify the best specific antibiotics to treat the bacteria that causes that infection. And then, when to consider the next step. So if you've done the kind of initial treatments that we talked about, especially the saline irrigations and nasal sprays, and they're not working well enough, if you're needing frequent oral steroids and are kind of getting exposed to those side effects over and over again, if your polyps are really large and they're blocking your breathing and you're just miserable, if you have sort of bad asthma or bad AERD that's poorly controlled, or you're just having significant impairments in your quality of life, it's really important to talk to your doctor about, hey, I think I might need something more. And in terms of what the next steps look like, you might want to talk to your doctor about considering something like surgery or biologic therapy. So what are biologics? These are newer treatments that can really target specific molecules that drive inflammation. They've been shown to improve symptoms like congestion, loss of smell. They can decrease the nasal polyp size, reduce inflammation. What's nice about them is they can treat other problems. So if you have nasal polyps and asthma, one medication might treat both. They are given as injections or shots that you can give yourself at home sometimes, or sometimes are given in the doctor's office. And these are not curative. They're really a long-term management tool. So when you start it, it is a medication that you will be on for a while at least. And, this is a plug for our next session where we'll really take a deeper look at biologic medications for nasal polyps. And you can watch it at afa.org/NPS.
So we're going to talk through a couple of options of common questions that we might go through and what to expect from future workshops that are coming up from this in terms of, what else we can provide for you. And, these are some common questions that we often get from our patients. And then I think it might be helpful for just Dr. Buchheit and I to talk about how we would answer them for ourselves or how we would talk about it with our patients. And so one that comes up a lot is sort of what are the side effects of some of the medications that we might treat for nasal polyps, especially of the set that we've talked about today. And the answer is that it depends a little bit on the medication specifically. But honestly, overall, out of all the medications we talk about, oral corticosteroids or systemic corticosteroids like the prednisone, to me, are the ones that I'm the most concerned about in terms of their side effects. I don't know, do you have others that you are also worried about?
Yeah, no, I agree. I think the one that we really focus on other therapies to limit the use are oral or systemic corticosteroids. I think with intranasal steroids, they're generally well tolerated. We talked about sort of nose bleeding as being a side effect, and proper technique can mitigate that. Another potential thing to kind of consider is that you are spraying steroid close to the orbit, so close to your eye. And so we do recommend that, especially, adults who have been on high dose intranasal steroids for a long time, get regular eye exams to monitor for things like glaucoma or development of cataracts. There actually aren't great studies that show that intranasal steroids cause those things. However, we know that putting steroids directly into the eye can cause those things. So it's kind of extrapolated from that, meaning that, we just want to be cautious, and every adult should have regular eye exams anyway. So it's a good habit to get into for people who are on intranasal steroids.
Good. And then we're often asked, are there any medications that are better than surgery or more effective than surgery? And again, that's kind of cheating because surgery all at once goes in and physically just takes out all of the polyps. And that's a lot to ask of a medicine to do that. So in general, I would say, no, there aren't medicines that are better than surgery necessarily. In the next session, we'll talk about specifically the biologic medicines that we really haven't gone into at all today. And there are some of those that can have effects that are like surgery. Surgery is amazing. You just go in and take out all the stuff that's blocking your sinuses. It's hard to argue that there's even medicine that'd be better than that. But I do think the question of should I consider medicines before surgery or after surgery? My hard answer to this is both, right? For sure. It would be very odd to suggest that you go to surgery if you have never tried any of the medications. But also I hear from my surgical colleagues a lot that after surgery, you have to be really good about continuing with your good sinus and nasal care. So those sinus rinses that I talked about at the beginning, super important after surgery. And the intranasal corticosteroids that Dr. Buchheit talked about, super important after surgery. In fact, one of the sort of hopes of surgery is they actually go in, get everything out, and make extra kind of spaces in your sinuses so that those steroids, those intranasal steroids that Dr. Buchheit talked about, can get to where we want them to go now that there's a big open space in there.
Yeah, I think that's a really important point. And one sort of thing that I tell to all my patients is this isn't really a plumbing problem. It's not like having your appendix out where it's gone and then you don't ever have to think about it again. Unfortunately, it's an inflammatory problem. So the benefit of surgery is that those steroids, one of the benefits of surgery is that the steroids can actually reach way high up where the polyps are starting. And so actually the point of having surgery is so that the medicines can work even better. So I think it makes a huge difference to be really good about taking them after.
Yeah. So, you were the one who went through all the nasal sprays, but in general, when patients say, can I stop my nasal sprays? Unless you have absolutely no symptoms and feel awesome, no, you can't, unfortunately, stop your nasal sprays. That's what we're stuck with now. And I think the question often, if we're suggesting a new medication, if it's a prescription over the counter, patients will say, well, okay, what do I do if this doesn't work for me? And the answer is it kind of depends on which medication you're talking about. Sometimes it's a technique thing. So what Dr. Buchheit went into, which is use the right hand for the left nostril and the left hand for the right nostril, just that tiny little tweak can actually make a huge difference for patients. That being said, I don't want my patients to try something for an entire year, properly use it, and then realize it just didn't work at all and they were miserable for all 365 days. Reach back out to your provider. There are usually more things that we can do if that set of medications that you're trying isn't working well enough for you. And we want to make sure that we can really personalize what you need for your symptoms with a collection of medications or surgeries or biologics that we have available to us now.
All right. Well, Dr. Buchheit, Dr. Laidlaw, thank you both, of course, for discussing our medical options for nasal polyps in this video. We're, of course, excited for our next one, which they kind of hinted at. In our next series, we're going to discuss biologic treatment options, surgical options for removing nasal polyps, navigating nasal polyps and related chronic conditions, practical tips for managing nasal polyps, holistic health approaches, and more subjects. Of course, thank you all for being with us today. We look forward to seeing you in our workshop 3. We'd also like to take a moment to thank Sanofi and Regeneron for their support for this educational program. All content was developed independently by AAFA and the speakers. Thank you for joining us, and we'll see you again soon.